Diarrhea.
Oh, man. Late night urine emergencies, living with half a brain, and birth by fighter pilot force? What in the... Today, we're breaking down and reacting to some of the most shocking medical cases, bizarre biology experiments, and straight up unbelievable internet stories from Zack D Films. Let's dive right in.
The table would spin the mother around as she was giving birth, and it could generate up to 8 Gs of force, the same amount a fighter pilot would feel at high speeds. As it spun, the baby would be pushed downward.
I can't even handle like 1 G or 2 Gs, 8 Gs. I feel like somebody's gonna pass out. I don't know what that type of pressure is gonna be doing on the baby as well. There's not a lot of research on that, so I don't think it's appropriate.
A small net at the end was supposed to catch it once it was born. Doctors would be there to help the process go smoothly, but even though the idea was patented, it was never used in hospitals for obvious reasons.
The body goes into certain phases of labor. There are contractions that are happening, cervical dilation that are happening, and then there also is station or position of where the baby is within the birth canal itself. You might be starting with, maybe a dilated cervix, but the baby is really high up in the pelvis. So no matter how much spinning you're doing, if the baby's not in the correct position, it might cause more harm than good.
Diarrhea.
Oh, man.
Exploded from the woman, splattering the seats and dribbling down the aisle.
That's awful.
That's awful.
What ends up happening is, depending on the type of infection or whatever is causing the diarrhea, sometimes it can be really bad and smelling. Like C. diff colitis basically has a very horrific smell that you can smell miles away, so to speak. Not miles, but it does have a very distinct smell, and it's pretty malodorous.
She was on a flight when her stomach suddenly began hurtling, and she got up to use the bathroom, but she didn't make it. The smell hit immediately, making nearby passengers gag and retch.
Oh my gosh, that is the worst. You can pass along infections by fecal oral route, get it in your mouth or mucous membranes. Now you're gonna get whatever is causing the issue to this individual, so that's awful.
The crew's desperate attempts to clean it only spread the mess further, and it got so bad that the pilot decided to make an emergency landing.
Was probably the right call. We see a lot of viral spread of illness on cruise ships because you're confined for a long period of time. Something called norovirus is a big one, to where people can contract it pretty easily. Really not much therapy outside of nausea medicine, hydration, and time to allow it to kind of get through your system.
If you wake up at night with a full bladder and empty it too quickly, it can fire up a nerve connected to your heart.
Controlling your speed at which your bladder is emptying. How many of us are really doing that? Typically, it's a passive event where you're relaxing your sphincters, the muscles that actually keep everything tight. The bladder is a muscle. Sometimes you can squeeze or increase intra-abdominal pressure to make it urinate faster. Most people don't do that.
In some people, this nerve sends a signal straight to the heart, slowing it down and widening the blood vessels.
What's actually happening is now there's more space in the abdomen as well, so your blood pressure can drop from that standpoint because now you're having more of your venous blood pooling.
This could cause your blood pressure to drop, so less blood flows to your brain, making you feel dizzy until you faint right there in the bathroom.
The brain-bladder interaction between the two is true. Quite common when people come to the emergency department, they tell us they'll get up and go to the bathroom and then have a syncopal episode, which is a fancy medical term for passing out.
If a 9-volt battery was pressed against a nose ring, with the ends connecting to make a loop, after a few more seconds, blisters would start to form, and if it was left on for long enough, it could permanently damage the nose.
That is very true. Just like a normal burn would happen. You're starting to get redness to the tissue. You're gonna start having blistering to that tissue, and then you can actually break down the cartilage in the middle. Because it's the nose, it's basically treated as like an end organ. So if you start having more damage to that area, the blood supply will also get compromised, and thus you're gonna have breakdown of the tissue. You can have necrosis of the tissue, and then it's gonna be really hard to fix and heal. Please don't do this.
Put a piece of garlic into a plastic bag, then crush it until it breaks open. Next, slide the bag onto your foot, and as your foot touches the garlic, it releases compounds that pass through your skin and enter your circulation.
Your soles are very thick skin, but again, they're skin in and of itself, so they can be porous, so you're getting some absorption. We have medications that are transdermal. We put on patches and people can absorb them, but our skin is actually very good at forming a barrier for the majority of things.
Traveling all the way way up to your lungs. So as you breathe out, that garlic smell travels through your nose and mouth, which your brain experiences as taste.
Garlic is good for us, ingested. But it is an old wives' tale relating to the garlic on the feet will help infection, colds, flus, boost your immune system. Have you guys ever heard of this or even tried it? Let me know in the comments and let me know what your experience is like.
He ate fries, potato chips, and white bread for every meal.
Oh.
And that's basically all he ever ate since he was young.
Really important to get a balanced diet and not one that is highly processed. Fruits, vegetables, very, very important. We do need a balance of protein, carbohydrates, and fats in our diet.
Something started to go wrong. You see, his nerves should have carried messages from his eyes to his brain, while a fatty coating protected them.
The fatty coating is also called your myelin sheath. It's like the coating over wires to allow it to continue to transmit further distances.
His diet didn't give his body what it needed to repair this fatty coating. And eventually, it got so thin on the nerve that controlled his vision that the messages never made it to his brain. This caused him to go legally blind.
Why in this video the optic nerve or the vision nerve was affected? It's very sensitive to appropriate B vitamins, and it needs B vitamins B1, 9, and 12 specifically.
If you sprain your ankle,
Ouch.
take a handful of leaves and rub the area with them. You'll notice the pain won't feel as bad. Pain signals race up your spine. The signals travel up to your brain, forcing you to feel it.
That's why, very interestingly enough, when you first have the injury, it may not hurt right away until you realize that you had the injury. There's a little bit of delay because that signal is going to your brain. Even when I injure myself, it does feel better right away if I rub it, not even with leaves, if I just rub it on its own.
When you rub your ankle like this, it sends a second touch signal through a different set of nerves. And this actually closes the gate to most of the pain signals, meaning you feel the leaves more than the sprain.
We use nature in and of itself for its medicinal purposes. Leaves of plantains are used in anti-inflammatory, aloe as well, a lot of herbal medicine out there. The classic way to actually help an ankle sprain is rice, rest, ice, compression, and elevation.
A surgeon will make an incision in your scalp and remove a part of your skull if you get an anatomical hemispherectomy.
Those terms are just a fancy word of we're going to remove part or half of the brain tissue there.
Then they will carefully separate the affected half of the brain from the healthy one, severing necessary connections.
Why would you actually have one of these procedures done? It could be multiple different reasons. Potential infection, tumors, genetic disorders, uncontrollable epilepsy, the list goes on.
Next, the surgeon will completely remove it from the skull and close the wound. As you heal, the brain's remaining hemisphere takes over many functions of the removed side.
You have a better chance or a better outcome or less change to your life when it's done younger in age than as we get older, and it has to do with the neural pathways that have already been developed. Sometimes the brain tissue will just stay missing, so you have something called encephalomalacia potentially, or just a devoid of that area, which typically is end up filling with cerebral fluid.
The army ant is placed on the wound and positioned so its jaws clamp tightly on the edges, securing them together.
What would we normally do with a suture, right, or a stitch? You literally take your needle that has a curve, typically nylon as the material. You make an arc, you go underneath, and you tie it, and it becomes like a big circle like this to approximate the wound edges.
The ant's body is twisted off,
Stop
leaving
it.
its head and mandibles in place, which acts as a stitch. More are added depending on the size of the wound.
You still need to prep the tissue to make sure you don't get infection. Same with somebody who comes to the hospital, we gotta clean the skin around it before I make those sutures because there's bacteria on the skin.
These ant stitches are left in the skin until the edges of the wound stay closed on their own.
This is actually used in areas around the world where you don't have access to potential potentially a suture, and you need something to close your wound. Handling them and controlling them, I think, takes a little bit of time and practice. Any of you out there ever done this before? It's actually pretty crazy and cool and sad for the ant, but you heal.
If your ear gets ripped off, you can actually take some cartilage from your rib cage.
Yeah.
Then a doctor will carve it into the shape of an ear and place it into a pocket of skin on your forearm.
Our ribs attach to our sternum by cartilage. Sometimes people end up getting costochondritis, which is inflammation of that cartilage, which causes sharp chest pain. Just so you know that there is cartilage in that area and it does get inflamed, and we can use it for other means.
Inside your arm, it develops and forms new blood vessels and skin. Once it is fully developed, the new ear is removed from your arm.
Your ear is all cartilage with some blood vessels and skin around it and a little bit of subcutaneous tissue. Can you put it in a pocket somewhere? Anywhere? Yes. Forearm, hip, belly, anywhere.
The new blood vessels are attached to your ear hole, and the skin is carefully stitched to your head, giving you a new ear.
Can you then put it back on? The issue will end up being the nerve growth. So you have neovascularization, so new blood vessel growth, but nerves take a lot longer. And is that ear innervated, or do you have like nerve function to that area? It could take a long time to get that to come back. If it does,
a doctor could theoretically sever all of the blood vessels in your neck and connect them to the neck of a donor body. Then the muscles, tendons, and bones are precisely cut and your head would be fully disconnected.
Yes, but nerve function probably, most definitely at this current time, would not be functioning appropriately.
The surgeon would then spend hours reconnecting everything in your neck to the donor body. And once everything is attached, in theory, your head would be completely joined to a new body.
Could you take those blood vessels methodically and attach them? Yes, you could. And muscles, bone, ligaments, tendons, all that stuff could be reattached. The minute you sever that spinal cord, then there's no more function. So there hasn't actually been a successful head transplant in medicine.
If someone has bone cancer in their femur, a surgeon will sometimes amputate the affected area, removing the entire middle part of the leg. But they leave the major vein, artery, and nerve intact.
How amazing is that? But it's true. Bone cancer in this specific area you don't see so often, where it's just isolated, where they just need to have this amputation. But people do get bone cancers, and if you can fix it in such a way that gives them a meaningful rest of their life because you're able to save the joint, it's amazing.
Then they bring the lower part of the leg up and rotate it 180 degrees. By turning backwards, the ankle joint essentially becomes...
How cool is this?
This is because it can mimic the knee's bending motion.
I've done amputations when I was a resident. You're leaving a stump, and that could be painful, uncomfortable, putting a lot of pressure on an area, versus here, your joint's going to change and have to adjust, but our brains are amazing. They can figure that out.
And while it might look bizarre, it's actually very helpful for amputees. The backwards ankle fits perfectly into a prosthetic and gives more stability and mobility.
You keep the ankle, but you keep the foot. There's no need to get rid of the foot. It actually gives it more of an area of structure and support.
In 1848, a large iron rod drove through the face and head of a man while he was working on a railroad.
This is why I say never pull anything out, because you need a surgeon there to double check structures it's going through.
It passed behind his left eye and exited through the top of his skull, and he somehow managed to stay conscious while the rod was removed.
Went through the face, so you're bleeding, fractures. The left eye probably wasn't functioning anymore because behind the eye you have your nerves, your muscles, so if that connectivity got messed up, the likelihood that you'd be able to fix it is pretty darn low.
Now, he did survive this incident, but he wasn't really the same person. You see, the rod went through his frontal lobe, and this area of the brain is responsible for decision-making and self-control.
Very good example of frontal lobe injuries. It's very similar to what we've seen when people get shot, you get a stroke in the same area, personality change, decision-making. You see a lot of this too when somebody might even have Alzheimer's, where the Alzheimer's is affecting frontal lobe. Sometimes we'll even see this when somebody has a brain tumor that nobody knows yet.
If you were swallowed by a sperm whale. You would be squeezed down its massive throat. You'd continue down the esophagus and into a series of stomach chambers that are filled with digestive acids.
Stomach acids are designed to break down what you ingest, and they're highly corrosive. The stomach lining has to rebuild itself because of the acid environment.
And these acids would immediately start breaking down your body. But even if you managed to avoid the acid, the lack of air inside the whale would quickly cause you to suffocate.
Now you're inside a closed chamber that oxygen is not getting into. So you're breathing out some oxygen, but you're mostly breathing out CO2, right? Most of the time you're going to suffocate, but you're actually going to get lightheaded, dizzy, and slowly fade away.
If a kernel of corn somehow got up your nose, some people think that it could potentially sprout, meaning you'd literally be growing an ear of corn in your nose.
We do pull a lot of foreign bodies out of people's nostrils. Typically, many different tricks to get it out. If something is stuck and it's further back, you can just blow it further into the back of the throat. Just don't inhale it.
Now, this is obviously crazy, but a 4-year-old once inhaled a bean, which then got stuck inside his nose. And because the nasal cavity is warm and moist, it allegedly created a suitable environment for it to germinate.
Another way is if it is your own kid and say it's more in the front of the nose, you can blow air into your child's mouth, hold the one nostril that there's no foreign body in, and it should come shooting out.
After several days, the seed actually sprouted and began to grow until it was removed by doctors.
That one was easy because the sprout came out, so you just grab onto it and gently pull. There's another thing that we use. There's a device that's almost like a very thin stick that has a little balloon on the end, but the balloon is collapsible. So you put it past it, blow the balloon up, and just pull it forward.
If you stopped blinking for 30 seconds, the moisture on your eyeball would start evaporating. And over the span of a few minutes, the first layer would dry out since it relies on the eyelids to cover it with moisture.
When somebody's having procedures done of their eye where their eyes are open like this, the doctor is going to be using ointments and drops to keep your eye moisturized. In the emergency department, the most common area that I see this happen is when somebody has Bell's palsy. Bell's palsy does not allow you to totally close your eyelid and blink, so it dries out your eye.
After about 10 minutes, your vision would become blurred as the tear film breaks down. And a few hours later, all moisture would be gone, causing damage to the cornea, which would significantly impair your vision.
If thought-provoking scenarios like this keeps your mind racing at night, you might need a little help shutting it off. That's where Do Not Disturb comes into play, my doctor-formulated sleep support supplement. Check it out at lifehappens.com or on Amazon.
He had another head growing right on top of his own, one that could blink and smile independently.
Wow.
And this head was actually his twin that didn't fully separate in the womb.
Which is actually called a parasitic twin.
It would cry when he laughed and stare blankly when he slept. Now, each head was actually functioning off of their own separate brains.
So it depends on the attachments, depends on how this formed. It's not always like two separate brains or separate organs. Sometimes they can be sharing. Zack D Films, these are great videos, great education, just enough science to not overwhelm you. I think did a really, really good job of allowing people to learn things that maybe wouldn't have ever learned before. So really cool, really amazing. If you guys want me to do more, let me know in the comments. And as always, definitely check out this playlist right here. Binge watch everything. Do me a favor, subscribe, turn on your bell notifications, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.